Good afternoon, folks. This afternoon's topic is taking iron supplements when you are iron deficient and the discomfort it causes. And the second half of that later is discussing how iron affects your body. So, first one is taking iron supplements. So, we shall delve into that right now. Taking iron with food. Consuming iron supplements with food can reduce stomach irritation. Choose foods rich in vitamin C like citrus fruit or bell peppers because vitamin C enhances iron absorption. Okay, 2 down this list is gradual increase. Start with a lower dose and gradually increase your dose of pills for iron. This allows your body to adjust and minimize the risk of nausea. Okay, 3 down this list also is split doses. Instead of taking one large dose, split it into smaller doses throughout the day. For example, take half in the morning and the other half in the evening. 4, choose the right form. Some iron supplements cause less stomach upset than others. Ferrous sulfate is commonly used but can be harsh on the stomach. Okay, consider other forms like ferrous glutamate or ferrous phosphate or fumate, ferrous fumate. Avoid food and beverages. Okay, avoid taking iron with dairy products and acids or calcium supplements. Okay, let me set this over here. These can interfere with iron absorption. Oh, and a big one. When you're taking iron, stay hydrated. Dehydration can worsen nausea. Drink plenty of water throughout the day. 7, lie down after taking iron. Some people find that lying down for about 30 minutes after taking iron helps reduce nausea. Remember to consult your healthcare provider before making any changes to your iron supplement regimen. They can provide personalized advice based on your specific needs and healthcare conditions. Okay, so then second part of today's video This will, along with iron deficiency, comes anemia. Okay, that is when somebody's skin, you're anemic because you're white. Your skin's very white. Okay, so we're gonna go discuss that now. So, let's see. Anemia is a condition characterized by a deficient of healthy red blood cells or hemoglobin, which impairs the ability to carry oxygen to the body tissues. As people age, the risk of anemia increases. Here are some key points about anemia in older adults. 1. Increased risk. People over the age of 65 are at an increased risk of developing anemia. Research indicates that depending on the population, 12 to 47% of older adults may experience some form of anemia. Okay, here we go with complications. 2. Complications. If left untreated, anemia can cause or can lead to various health problems, such as severe fatigue. Anemia can cause severe tiredness, making it challenging to perform everyday tasks. Underneath that, pregnancy complications. Okay, that explains. Now I'm going to explain that. Pregnant individuals with folate deficiency, anemia, may be more likely to experience complications, including premature birth. 3. Gender deficiency. The risk of anemia varies by gender. Females, higher risk during pregnancy between the ages of 40 to 49, and between the ages of 80 to 85. Males, rates of anemia increase throughout adulthood. Unidentified causes. Okay. Many factors contribute to anemia, including poor diet, intestinal disorders, chronic diseases, infections, and other conditions. Women who menstruate or are pregnant, as well as individuals with chronic medical conditions, are particularly susceptible. Okay, then we go down to the disclaimer. Remember that early detection and appropriate management are essential for maintaining overall health. If you suspect anemia or experience symptoms like fatigue, weakness, or shortness of breath, consult your healthcare provider for proper evaluation and treatment. Okay, so that is page 1 of anemia. Hold on. Bear with me a second, please. Let me get my other notes here. Okay. Some people experience side effects taking higher doses of iron. Okay. Unabsorption can oxidize and cause gut irritation, leading to constipation and nausea. Remember, individuals' responses to iron can vary. It's essential to consult healthcare provider if you experience adverse effects after taking iron supplements or receiving iron infusions. They can guide you based on your specific situation. Okay. All right. Now here is some iron discomfort that I'm going to go down the list and discuss also. Iron can sometimes cause discomfort or nausea when taken as a supplement. Let me explain why. Iron supplements and nausea. When you swallow an iron pill and it leads in your stomach and comes into contact with stomach acid. All right. Okay, when it comes into contact with stomach acid, for some people, this process can irritate the lining of the stomach and lead to feelings of nausea, or even vomiting. Okay, here we go with now we're down to 2. Iron infusion. An iron infusion is a way to receive iron through a small catheter in your vein. Intravenous iron supplementation. If you don't have enough iron in your body, can make your body can't make hemoglobin, which helps the body carry oxygen throughout your body. Factors that can lower your body's iron supply include blood loss, dietary deficiencies, and medications that interfere with iron absorption. People usually receive IV iron infusions when they can't take oral iron, such as those with gastrointestinal bleeding, inflammatory bowel disease, or anemia. Okay, and now I'm going to go to 3, which explains iron overdose. Uh, Iron overdose. Too much iron can irritate the stomach and digestive tract, sometimes causing bleeding. Acute iron overdose can poison cells, affect chemical reactions within hours. Liver damage can occur within days if iron levels are excessively high. 4. Unabsorbed iron and gut irritation. So those are some pointers about iron overdose and iron deficiency. Which case in point, I go through that at least. Um, I get infusions also, at least one bag every 3 months. So it's rough on me also as a person. After I get infused, I get very tired. Um, I mean, I don't go out. I limit how much time I go out when I have an infusion done, because you get very tired, and all you want to do is sleep. So to combat that, also eat out of cast iron pans. They tell you cast iron's the best way to go if with dealing with having enough iron in your body. The best source is an iron skillet, iron uh, iron Dutch ovens, iron pots, iron baking dishes. That is some ways of getting iron into your body. The best meat that somebody can take is red meat and or um, beans or uh, spinach or broccoli. Um, I mean, it depends on the person, though. Your iron deficiency depends on how bad it is and which route you decide on treating yourself, uh, with your doctor's help, of course. So this afternoon's discussion, I thought I'd jump on and give people some ideas as to iron deficiency. So I hope that helps some people. Gator Wellness signing off for now. I might jump back on at 9 or 10 tonight and do another show. So I hope everybody sticks around to see what tonight's show is. Everybody have a good afternoon. Take care.